Visitors to the Napa Valley are bound to encounter what residents are long used to seeing: billboards and bumper stickers announcing the no-wait ER at St. Helena Hospital, Napa Valley. In popular imagination, fueled by the media, emergency rooms are either places of high drama, with critically ill patients arriving by helicopter or ambulance, or they are places of excruciating boredom and discomfort, as patients often sit for hours waiting to be seen. St. Helena Hospital, Napa Valley offers its generous community the kinds of services you'd expect to find only in large population centers. The No-Wait ER is another example of the hospital's commitment to world-class care, and it's made possible by our favorable demographics.
Our facility, we have 8 beds, and we only see roughly 20 patients a day. And so with those numbers, we're able to bring patients right back to a room and start treatment right away.
We have to treat the most critically ill patients first. And so if we have a heart attack and an earache, the earache patient might have to wait a moment. But basically, no-wait ER means that we will have a care provider, a nurse or a physician, evaluating you within moments of your arrival.
Over the last 8 months, I think we've had 2 people that have had to wait longer than 15 minutes in the waiting room. So it's quite rare that you can't be brought back immediately.
While some of our patients do arrive at the ER via ambulance or helicopter, by far the majority of them arrive by walking through the front door.
We are greeted by our clerk, who basically asks your name and date of birth, and immediately you're brought back into the emergency room.
Come on back.
We bring them directly back to a room to start their care.
This will be your room. Have you get into a hospital gown?
Once a patient is changed into an examination gown and been situated in bed, the triage nurse initiates monitoring and continues the patient interview process.
When did your abdominal pain start?
The nurse is going to see you. We're going to get you hooked up to the monitor, start taking your history.
And I ask patients all kinds of questions about allergies and medications, about their history, if they've ever had any surgeries before.
Have you ever had any surgeries on your abdomen?
No.
Okay.
And when someone comes in, you have to put the pieces of the puzzle together. You have to solve the mysteries.
So I'm going to go ahead and have the doctor come in and see you right away, and then I'll be back in to ask you more questions.
Okay.
And the physician is going to be able to come and see you very quickly after your arrival. Hi, Carla.
Hi.
Hi. I'm Dr. Love.
Nice to meet you.
Good to meet you. Sorry I had to come into the ER today. What's going on? We'll try to discern what your issue is that brought you into the ER that day and what needs to be done in order to stabilize or diagnose that condition. Sometimes that might take 3 minutes because it might be a tick bite that you're concerned about, or it might take hours because you're having a major heart attack or you're having abdominal pain. But we have all the services here to help diagnose those things. If it's an MRI, if it's a CAT scan, if it's an ultrasound, we have a great radiology department that can help us with some of those modalities, along with the laboratories. We can do those immediately here in the emergency room.
It's really neat to be able to get tests right away to verify what you think is going on, and I just absolutely love just solving the mystery.
Well, this is a full-service emergency department, and so we take care of everything from rattlesnake bites to traumas to bicycle crashes and earaches and fevers.
You have some chest pain, you're very concerned what might be happening with your heart. Not only do we have all the cardiologists and cardiothoracic surgeons that can take care of you, but we have a cath lab so we can immediately intervene and to improve your health and survival chances.
National Patient Satisfaction Surveys conducted by the National Research Corporation Picker Institute repeatedly show the results of St. Helena Hospital's approach to emergency room care.
Out of those, we consistently score 97th percentile and even have scored 100th percentile several times.
And as a matter of fact, last year for one of our quarters, we were the highest ranked emergency room in the country.
We have a really good team that has been here and worked together for a long time. We have very little turnover in our staff.
We've had the same group of nurses and physicians working together here for a very long time. We're a very close family.
And we all have in our hearts the desire to give excellent care. We treat each patient as though we were taking care of our own family, and that we really want to see them well just as much as they want to be well.